The heart is often considered one of the hardest working organs in the human body, and for this reason, it may experience significant wear and decreased function much sooner than other organs. A decline in your heart's overall function comes with both obvious symptoms and hidden signs, and paying close attention to them can help you prevent much more serious problems like heart failure and heart attacks. In this video, we'll get to know some of these hidden signs better. Hello, and welcome to the Dr. Koob YouTube channel. In this video, I want to introduce you to 11 critical warning signs that indicate your heart is at serious risk. Please stay with me until the end of the video. Many of these things you might be hearing for the first time, and understanding these essential health tips can help guarantee the health of yourself and your loved ones. Throughout my talk, I'll also share with you my 12 years of experience working with heart patients. The first sign is that you get tired easily. If you used to walk or run long distances every day, but now unexpectedly find that you are no longer able to perform these activities and experience severe fatigue, it could be a clear indication that your heart is not pumping a sufficient amount of blood to various parts of your body. Engaging in daily activities that used to be effortless for you in the past but have suddenly become quite difficult can often serve as a significant warning sign of a potential underlying health issue. If even a good night's sleep doesn't help relieve your fatigue, see a doctor as soon as possible to determine the exact cause of your condition. The second sign. You are experiencing problems in your sexual relationships. Erectile dysfunction is a classic warning sign of a potential heart disease threat. Anxiety, depression, and psychological stress can deeply affect a person's sexual performance. But these problems can also be caused by restricted or blocked arteries in the heart, which prevent the necessary and healthy blood flow to the penis. Erectile dysfunction caused by vascular problems is the most common type of sexual dysfunction, and it often results from two conditions: atherosclerosis and endothelial dysfunction. Atherosclerosis, or the progressive thickening and hardening of the arterial walls, causes the arteries to become more rigid and narrow, which can lead to serious conditions such as heart attacks and strokes. Endothelial dysfunction significantly hinders the ability of blood vessels to dilate and relax properly, which consequently leads to reduced blood flow throughout the body. If this is your first time visiting the Dr. Koob YouTube channel, please hit the subscribe button right now and become part of this community of thousands. Every night I bring you new content as a guest to your attentive eyes. The third point, if you suffer from high blood pressure. A clinical diagnosis of high blood pressure can increase your risk of heart attack, stroke, or heart disease. If you don't manage and lower your high blood pressure, this condition can severely damage your arteries and lead to the gradual buildup of fatty plaque along their walls, which eventually obstructs the flow of blood throughout your body. The narrower these blood vessels become, the harder and much less efficiently your heart and blood vessels have to work. The fourth point, if you suffer from unexpected and persistent coughing fits, don't let the coughing fool you into thinking you've simply caught a common cold. If the cough refuses to subside after several weeks, this could indicate the possibility of a serious underlying cardiovascular condition. When the heart fails to pump blood effectively, fluids may leak into unusual areas, like the lungs, and gradually accumulate within those tissues. The accumulation of fluid within the lungs as a direct result of heart failure can often cause persistent wheezing and a heavy cough. These symptoms can easily mimic other respiratory conditions like asthma or chronic lung diseases, even though the real underlying issue is a heart problem. Fifth point, you may find that you have significant trouble breathing comfortably while you are sleeping at night. Obstructive sleep apnea, or the repeated cessation of breathing during sleep, frequently causes a person to abruptly awaken in the middle of the night gasping for air. This condition is linked to a higher risk of heart attack or atrial fibrillation, which is a type of heart arrhythmia. In fact, every single individual part of the heart starts generating beats, causing the heart to quiver. When patients with sleep apnea fall asleep, their blood oxygen levels begin to drop significantly, and the body enters a state of panic, signaling the blood vessels to increase the flow of oxygen to the heart and brain, which leads to shortness of breath. People with sleep apnea are often at a much higher risk of developing high blood pressure as well, which is another clear sign of an unhealthy heart. Number 6. You may notice you have no hair on your legs. Hairless legs can often mean a lack of oxygen in the limbs, because blood flow has decreased as a direct result of narrowed arteries. Without blood rich in vital nutrients, your hair follicles are simply unable to grow. Hairless legs or slow-growing or weakened hair on the legs due to poor blood circulation is one of the common signs of peripheral artery disease. Consulting a doctor in this case is the best course of action. If you haven't liked this clip yet, now is the time. Please hit the like button right now, because doing so shows that you really value this clip. 7th point. Your legs have become swollen. If you suddenly feel like your everyday shoes have become tighter than they were before, this could be a serious sign of an underlying heart problem. When the heart muscle doesn't pump blood efficiently, the veins have trouble returning blood, and excess fluid enters the body's soft tissues. This process leads to swelling in areas like the legs, the abdomen, and even the scrotal sac. If you notice swelling in unexpected parts of your body, it could be due to an accumulation of excess fluid in the tissues, and you should consult a doctor for an accurate diagnosis. 8th point. If you suffer from persistent neck or jaw pain, pay attention. Most people think that chest pain is the primary sign of a cardiovascular condition, but in reality, symptoms of heart issues can also appear in various other parts of the body. Pain in the neck or jaw area can be a sign of angina. Angina is a heart problem that affects a person before a heart attack and indicates that the heart is not receiving enough oxygen-rich blood, and the oxygen supply to the heart has decreased. The sensation that angina patients describe is that they feel a lot of tightness in their chest. They feel as if an elephant is sitting on their chest. The pain may also radiate to their neck, back, jaw, or shoulders. But it's also possible that this doesn't happen and they only feel pain in one specific spot. In fact, in patients with diabetes, these pains can be completely hidden because they suffer from neuropathy, and neuropathy causes the pain to be effectively concealed. 9th point, you may frequently suffer from a persistent shortness of breath. If you experience any unusual shortness of breath when climbing up a flight of stairs or running, this could be another warning sign of a potential heart problem. The 10th point to consider, your gums have become swollen and sensitive. Individuals who are suffering from gum disease frequently experience painful swelling, which is caused by underlying inflammation. Furthermore, persistent inflammation in the body can significantly elevate the risk of a heart attack. Individuals with chronic oral and dental diseases often have a high level of inflammation throughout their systems. Inflammation can trigger the development of inflammation throughout the body, including the heart. 11th point, you have heart palpitations. A rapid and irregular heartbeat can be a warning sign that your cardiovascular system isn't functioning correctly. Arrhythmia, or an irregular heartbeat, if not properly treated and managed, can lead to serious cardiovascular complications in the future. If your heart is significantly weakened, this condition can cause heart rhythm disorders. There are also 2 other important signs, and at the end of this video, I'll provide a separate video link for you, and here you can see its image. Please make sure to watch the video about the earlobe crease and the graying of the pupil. Prioritize taking care of your health and your loved ones. Please share this video in your family groups. May God be with you always.